to Rosa for presentation of the strategic allocation framework. Is that right?
Actually, Larry, I'm going to say a few words before introducing Rosa to go through that for the benefit of all concerned here. So as you all will recall at our January meeting, we talked about how CIRM is at an inflection point due to a variety of circumstances that all come together at the same time, be they budgetary, be they a dramatic increase in applications of grants at all levels, be it the developing and ever-changing technology in the field, et cetera. We felt, as you voted on earlier this year, that among other things, we needed to have a period of what we call flow control, which was to take a few months off in accepting plan grants for consideration to be revisited at the June board meeting. Part and parcel of that plan was the need that we have identified to figure out with the money that we have left at CIRM for the balance of Prop 14, that we need to figure out exactly where we want to spend that money. And towards that end, we embarked upon, at the Science Subcommittee's request and approval, the process of reprioritizing how we will accomplish that goal. So the idea of this reprioritizing, which is the first time we've done this in 20 years, essentially, we've certainly had major operational changes, but from a substantive standpoint on how we want to conduct ourselves, this is a big deal for us. So it's a multi-month process that we are undertaking, which is being led by a prioritization working group in-house, as overseen by the Science Subcommittee in general, and specifically by Mark Fisher-Coldry, who is heading up the oversight of reprioritizing for the Science Subcommittee and the board as things proceed along. This process is something that's going to take us through on our current calendar September, at which point we look to have recommendations to the board on how we would go about spending our money going forward in a very comprehensive and well thought out plan. The thing to keep in mind here is that because we are shifting course a bit under the context of the strategic plan, this new way of advancing the strategic plan is going to be targeting how we spend our money through the rest of the life of Prop 14. Now, having said that, obviously there could be times in the interim where we will want to revisit, as we are doing here, to figure out if there is a better way at that point in time to proceed. But from the standpoint of what we're doing today, the object is to set course for the balance of the time that Prop 14 funds are available. So, as you may recall, inside CIRM and inside our prioritization working group, which, by the way, you'll be interested to know has had a number of 2 to 4 hour meetings that we've set aside where we've been discussing this process and how we're going to go about doing things. Rosa has taken the lead in-house to project manage this whole thing, and the entire rest of the working group has put in many, many hours, and the team effort, I'd like to report to you, has been exceptional, collaborative, highly supportive, all on the same page, and driving towards what we think will be a very good result for the board and CIRM writ large at the end of the day in September, when you all hopefully will vote on what to do at that point. So today's meeting and Thursday's board meeting will be today in its entirety, and part of Thursday's board meeting will be about the process that we are putting together to drive towards ultimate recommendations. This meeting is not meant in any way to discuss substance, specific priorities, specific recommendations, anything besides process. And so Rosa has put together a presentation for you all to consider here on process. And I think with that, turn it over.
JC. Yeah, thank you. Great introduction. Can you all hear me?
Yes, loud and clear.
Great. Fantastic. So next slide, Sarah. So ultimately, this strategic prioritization framework that JT has so well introduced to us is a testament to CIRM's profound dedication to our mission, which is here, and that ultimately leads to transforming healthcare through the power of regenerative medicine, including stem cells and genetic therapies. Next slide. So this strategic allocation framework that we are presenting today is a structured and data-driven approach to prioritize resource allocation and provide further granularity in terms of impact goals and their success measures as well, that will ultimately lead to recommendations for continued implementation of our strategic plan. What we are saying here is that we are building all these over the basis of a strategic plan, but basically we are providing a lot more granularity and success measures to figure out how to move forward. Next slide. So in terms of background, what's the background of this strategic allocation framework? The framework has been developed over the past months and is poised to guide CIRM in making informed decisions regarding the distribution of our remaining funds. As a pioneer entity in the realms of stem cell research and regenerative medicine, our legacy has founded in the advancement of scientific discovery towards tangible medical breakthroughs and ultimately cures. Our institute has been instrumental, as we all know, in funding cutting-edge research, developing robust infrastructure. We pioneered a great network of educational programs, and we are catalyzing the progression from regenerative medicine research to clinical, practical applications, and ultimately, hopefully, cures. As we will see in the next slides, the field of regenerative medicine has grown exponentially in the past 17 years. And we also know that we have finite resources. During the September 2023 Science Subcommittee, board member Mark Fisher-Colbury kicked off a prioritization discussion in which the need for a strategic allocation plan was introduced. We called it prioritization, and we are now calling it a strategic allocation framework. During that meeting, the board members, the board asked CIRM staff to develop an approach and recommendations for prioritization. So what we've done over the past months is that we have developed this framework to provide these strategic recommendations for funding allocation. And this framework presented reflects a comprehensive strategy that will define the rationale, the objectives, the scope, and timeline necessary to establish CIRM's future course of action. This strategy serves as a roadmap for CIRM to maximize its impact and to continue its pivotal role of transforming healthcare through the power of regenerative medicine for California and ultimately for the world. Next slide. The strategic allocation framework, this is an overview of what does the strategic allocation framework consist in. It's basically, as I mentioned again, and I keep saying it a few times more, is a structured and data-driven approach to prioritize our resource allocation and provide further granularity in terms of our impact goals. We have defined what are the goals. We are defining what the impact goals that we want for our mission to be, and how are we going to measure that impact. And that will ultimately lead to the recommendations for continued implementation of our strategic plan. The document that we have attached as materials for today's meeting is structured as follows. It has background and rationale. It talks about what are the remaining funds, which we are going to go over. and what's the landscape of the regenerative medicine field. And then it provides an overview of what has been CIRM's impact to date, and then the process of what the strategic allocation framework is, and then a proposed timeline of when could these recommendations, what are the activities that are involved in the allocation framework, and then when the recommendations could become available. And the output of all of these will be recommendations for strategic priorities that you will see at the end. And as JT mentioned, we hope to have ready for September ICOC meeting. The next slide, this slide provides a snapshot of CIRM's remaining funds for the strategic allocation that we are talking about. As you can see on the left, the total research authority from Prop 14 and Prop 71 together is $7.64 billion. It's the net of operational and compliance oversight costs from the original $8.5 billion initially allocated by Proposition 71 and 14 together. As you know, it's $3 billion plus $5.5 billion respectively. In terms of current fund allocation, CIRM has a remaining balance of $3.54 billion. And this balance results from accounting for all expended scheduled payments and approved allocations to date. Within this remaining balance, specific earmarks, as we know, have been made to address critical areas of need. One is neuro. We have $1.11 billion left of neuro. The original balance was $1.38 billion because we have to account for administrative costs. Of the 1.38, we have 1.11 that are accounted in the 3.54, by the way. And also another allocation is the 93.56 million that has been allocated to initiatives that aim to improve access to and affordability to treatments developed from our research. This financial snapshot sets the stage for CIRM to deliberate on strategic allocation decisions that will shape the future of our field, balancing the drive for innovation with the imperative for treatments to be both accessible and affordable. Next slide provides an overview of the regenerative medicine landscape. As you can see, the landscape is marked by an accelerating pace of scientific breakthroughs and a rapid expansion. The data shown, which is taken from the Alliance of Regenerative Medicine Annual Data Report of 2022 and the American Society of Gene and Cell Therapy quarterly report of 2021. This data underscores the exponential growth witnessed in the sector since 2005, marking a trajectory of accelerated advancements in stem cell and genetic therapies. This expansion is evident, as we can see, across various parameters. There is an increase in the number of companies engaged in these therapies, and there's an expansion in the portfolio of new products. There's a growing number of academic faculty dedicated to this research, and a robust pipeline of research projects and clinical trials. The first chart on the left shows a steep increase in publications related to stem cells, gene therapy, and cell therapy, which is a testament to the growing interest and advancements in the fields. And then the middle and right graphs show us the expansion of pipelines for gene therapies and non-genetically modified cell therapies correspondingly. Each bar in these two right and middle graphs represent a snapshot of active programs and reflect not only the initiation of a preclinical and phase 1 trials, but also the progression to more advanced stages of clinical testing. The landscape brings to the forefront a compelling narrative, which is that the field of regenerative medicine is not just growing, it is thriving at a pace that requires a strategic and thoughtful allocation of funds. And with such a fertile ground for discovery and development, the implications for healthcare are immense, which underscores the importance of CIRM's role in strategically funding the most promising avenues of research that can translate into life-altering treatments for patients. The next slide for us shows us the impact to date. This is just to provide a bit of a context of where the recommendations are being made from. CIRM's impact to date has been realized through strategic investments in a wide array of initiatives that interoperate together to realize our mission. Until now, CIRM has been committed to a multifaceted approach that includes a focus on both rare and prevalent diseases. And there are 4 key areas of emphasis in our impact. One of the first one is development of cell and gene therapies. CIRM is currently committed to advancing cell and gene therapies from research to market through CIRM's clinical funding model and clinical infrastructure, emphasizing not only patient access, but also the scaling of manufacturing processes to meet the clinical demand. We are also emphasizing, and as you've seen as an example, the REMIND program was one of them, collaborative networks for discovery research. We are fostering collaborative networks to unite multidisciplinary teams and leverage external opportunities and funding as well, enhancing our understanding of disease mechanisms and leading to the discovery of novel targets and biomarkers that will push the boundaries in treatment development for these diseases. In line with Proposition 14, the first case that we have prioritized is in the development of treatments for neurological conditions in these collaborative networks. We have also invested and have an impact in training and workforce development, and as we've heard and as we will hear at the ICOC meeting, an update on this. CIRM's educational initiatives have set a new standard for workforce development in regenerative medicine, creating a comprehensive network that connects training with real-world application, and we are also interconnecting with our different programs. And advancements in regenerative medicine technologies is another of the impacts that we can talk about by supporting initiatives which advance our understanding of complex diseases. CIRM has been translating scientific excellence into substantial patient benefits. And we have supported research to improve the development of technologies such as cell reprogramming, gene editing, therapy delivery systems, etc. As it stands, this is how we see our impact moving forward. And part of the recommendations will be reevaluating these as part of the process. So one of the things that we've done, and we'll move now into distance, goes into the next slide, is that the impact goals that for CIRM are being reevaluated. What do you mean by that? This slide shows what the strategic allocation framework process consists in. And the strategic allocation framework that we are discussing today is a structured, forward-thinking approach. The first part of it is the impact goals. Our team is defining what are the goals and the impact and success measures and metrics that we will have to delineate in order to have an impact in the years that we have left of CIRM. The next thing that we are developing is the guiding questions that will help us figure out how are we going to lead to this impact, what recommendations we will have to make to the board in order to lead to these impact goals. And the third point is the data collection and analysis. Once we have these guiding questions, our team is going to delineate what data do we need to collect and analyze in order to answer the guiding questions that will help us make recommendations to delineate, to lead to these impact goals. So this is, in a nutshell, a very complex process that we have undertaken. Right now, we are in the second step. We've defined the impact goals. We are delineating the guiding questions, and we will shortly go into the data collection and analysis, which is what will probably take most of the time. Next slide shows the design questions. These are the very, very high-level questions that we came from in terms of the strategic allocation framework. How can CIRM make the greatest impact on its mission? And that's how we led to this impact goal definition. First, we needed to define that and provide success measures to be able to measure that we got those goals. And how might CIRM effectively allocate the remaining budget of this $3.54 billion to make that impact on our mission, right? So that's the kind of the nutshell of questions that then we have delineated the impact goals and the questions, and we will derive the data from. Lastly, I want to provide a timeline for this whole process. This is a pretty accelerated process. We are right now at the Science Subcommittee. I don't know if you can show where we are, Sarah. Yeah, so we are right here at the Science Subcommittee. The formation of the Strategic Allocation Framework Analysis Group is at the bottom. And as you can see, we've delineated the impact goals. We are defining the questions, the very granular questions, and we will start defining the data that we need to analyze. And this is going to be between now and June, by which we will be we will be reporting to the Science Subcommittee between now and the ICOC of June. Our team will be reporting to the Science Subcommittee to provide an update on where we are. And by June, there's going to be a revision of the flow control evaluation that our team will also be providing, and we will provide a formal update to the ICOC backed by the Science Subcommittee about where we are in terms of the strategic allocation framework. Now, given that we are doing this very strategic allocation framework and prioritization exercise, it doesn't make much sense to provide a full budget at the June ICOC. So what we would be proposing is to provide an interim research budget for the next 3 months and a full operations budget at the ICOC of June. And then by September, when we come with a finalized strategic allocation framework recommendations, we would come with a full research budget aligned with these recommendations. The recommendations will not only be for this year, obviously, they will be for the life of CIRM. And I think with this, I am ending my presentation. I don't know if you, JT, would like to add anything in terms of this timeline that I might have forgotten. But
no, Rosa, I think that explains it all very well. Again, this meeting is specifically about process, which I think Rosa has outlined to you. And so we would welcome any comments, questions, anything you'd like to, any input on this.
So let me start the questions with something that perhaps is a little unfair, but I am curious about. Have you guys discussed what the recommendations might look at? Will they be process oriented, or do you imagine that you're going to pick research fields that look more relevant or ripe for conquering, or number of patients with particular diseases? I guess I'm just asking, what do you imagine the end game will look like?
So, Larry, I think the answer to that question is, to this point, we've been all about process. So it would be premature for us to get into any discussion on those questions, although those are obviously very fair questions for later down the road.
Sure, no problem. Thank you. Maria.
Just curious, when this comes to the board in September, does that come also with concept plan changes that may be necessary given prioritization recommendations that you're making? Or does that then mean that once prioritization is voted on, that then those concept plan amendments or new concept plans or new programs or whatever may flow from this, that's when you start to develop those? And that's a a nuance, but informs budgetary spend, et cetera, between June or July 1st and the September.
So I'll, if I may, answer that one as well, Maria. So another very good question. I believe that our object is to come in September with the recommendations, having had discussions all the way along the way to get to that point, such that as we reach that meeting, we will have a pretty good sense of how things are going to go with the board. And given that, I would propose that we, to that meeting, also bring concept plans, because if we don't, then we're another 3 months before we're able to introduce those, and it pushes us that further down the road. So,
which is exactly why I was asking. Thank you very much.
Comment from me, if I can interject.
No.
Who is it?
Not yet.
Not yet. We're still going to the board members. We'll call for public
Okay,
comment.
thank you.
I guess I want to also just make a comment about the environment, and then we'll get to Pat. You know, the president's budget for the NIH has only a proposed 1% increase in it, which is maybe not surprising. Presidential budgets tend to lowball the NIH. But with the dysfunction in the House and barely better behavior in the Senate, the resource pinch may be particularly intense for the next couple of years. I'm not saying that you guys have an answer to this, but it is something for us all to keep in mind, because this is the context in which we're going to be operating. Pat.
Well, oh,
Yeah, I just wanted, Rose, I just wanted to clarify. So you have the total available, but you had two bullet points with dollars that are specified already. So the total in which the plan is going to be addressing is something like 2.34 billion, right? The remaining balance is 3.54 minus these two, which have direction in them with allocation, with working with groups working on how these are to be distributed separate from what you're talking about. So the remaining balance is something like 2.34. Is that right?
Correct. That is correct. That was in the document. Very good, Pat. Yes.
Okay. I just wanted to check. And if you go to the slide which has the landscape changing, did your meetings talk about the domains in which the landscape is changing most rapidly versus those that seem to be slower? Is that part of your analysis that's going to occur?
That is part of the analysis, and that could be some of the information. The idea that the leadership team prioritizing under JT's leadership has in terms of interactions with this science subcommittee could be, as we are delineating these questions that will inform the recommendations, we are going to be delineating types of data that we are going to be analyzing. And we will be coming to you not to show the analysis, but to show the types of data so that when we come with recommendations and a justification at the end, you can say, well, why didn't you do that? By that time, you will have already told us. So that could be the kind of interaction we would be having with the science subcommittee, which we hope that it's helpful.
Okay, that sounds fine. Thank you for the clarification.
Let me just make a comment about this, and then we'll go to David Higgins. You know, Pat and other members of the Neuro Task Force, I think as we start to close in on final recommendations, or maybe a little bit before that, it would certainly behoove us to be in active consultation with the prioritization work group to try to make sure that the recommendations for both are harmonious. So
yes,
that was with the timeline.
I think it's me.
Can you hear me?
Yes.
Yeah. This timeline, if you look at the ICOC meetings, on the top, there is an arrow between today, and the ICOC that shows April, May, June, TBD Science Subcommittee meetings. That is what Claudette and Scott will help us schedule, so we can have touch base meetings 3, 4 before the ICOC, where we would be discussing these and the questions and the type of data that we will be collecting.
Good.
So that's
Thank you.
aligned with what you are suggesting and what Pat is suggesting. Thank you.
Larry, can you, before you turn to David, Rosa, can you just get back to Larry's prior comment?
So Larry, you made a comment about the fact that the government funding will probably become harder to get, so there will be less funding. But right now, even without that predicament, our gates are flooded. So we have no identity in some ways as CIRM. And one of the things that we are trying to do with this impact goal definition and strategic allocation framework is to define who are we and how are we going to get there. And and make sure that we get there in the years that we have with the funding, instead of like just keep funding and not getting, to a cure or to define impact goals. That's the difference.
And I think, Larry, with respect to your comment about the NIH budget, it just underscores the importance of this process that we're undertaking right here. So we're
Absolutely. Yes.
very, very aware of that and are proceeding accordingly.
Yes, it's going to be chaos in Washington. David Higgins.
Yeah, just a small, probably trivial question, but we've talked about process and how that might change. And we talked about the money that we have to spend to affect that change. How far down do you see your the group parsing the choices? Are you going to choose by indication, by just the applications that come in over the transom, or is there some other slice and dice mechanism that we haven't used before that we're going to use that favors a certain indication or a certain class?
So David, the answer is, again, we haven't gotten to that level of discussion yet. We're still on the process, but all of that will be a part of it for sure. And I think everything's on the table is the answer to your question.
Okay.
We will look at all options, weigh all options, and make recommendations accordingly.
And the key will be the data. The data will justify, and you will be embracing the process and the data.
Correct.
I could imagine the reason for my question is I could imagine having a mixture of projects or products, but based not on somebody's favoring that, but more what's the equilibrium for the money spent to get what sort of pool of projects that make sense. That wasn't a question. That was just me ranting.
There's a hand up in the conference room. I don't know who's trying to speak there, but
I am. Sorry.
Vito.
Yeah, I'll wait after Shlomo. Go ahead.
I can look.
I think this is a very well thought through and necessary plan. Thank you. My concern is more on the non-scientific side. I'm very concerned with messaging. And we don't want this to turn into a negative opportunity to bash CIRM. And so I would like to see from staff a plan for messaging with actual bullet points, because otherwise we're going to be swamped with negative press. I can just see what the bloggers are going to write. And I think it started already when we first raised it a couple of meetings ago. There were some negative comments online. And so I'm just raising that for staff to consider for us.
Thank you. We will definitely take that advice. Thanks, Shlomo.
back to the conference room then.
Thanks, Larry. This is Vito. So this is a question in the form of a comment or a comment in the form of a question. The Finance Committee, I'll make sure, presents a budget to the board on time. And you know, our budgets, which cover administrative and research costs, are based on current experience and a look back at history, plus a little COLA, if you will, fudge factor. And that's going to become our budget, our funding document, starting July 1. But as we see in this presentation, there's going to be an ask of the board, we know it now, in September for a revision. And so I'm already starting to wonder, well, this is a delta to our budget. Is it going to be a plus, or is it going to be a negative, or is it going to be in the ballpark? I mean, the size of the delta is what concerns me already.
So thank you for the question, Dr. Imbasciani. So as we mentioned, for the operations, the budget will be the same. There will be no change. But at the June meeting, we will be presenting an interim budget. We already know which programs are slotted. There are 3 programs that are slotted between June and September. and we are going to budget for those programs. They are in two of our, in Dr. Chris's and my team. And then at the September meeting, given what we were just discussing in terms of prioritization and new concepts and modified concepts, that's going to be a delta that's going to be positive in the sense that we will be asking for most of the money for that year's allocation. So the delta will be positive. Make sense?
It does. I guess it's the size of the delta that
Oh, the size of the delta will be around the normal allocation, most likely, that we make, but I can't really make a prediction because the recommendations are going to guide. But I would say that, you know, it's going to be about the normal budget that we have for a year, but, you know, we can't predict. It will be aligned with the recommendations.
Correct.
beautiful. Great. Thank you.
Other questions or comments? So let me just reiterate what Shlomo said. I think it's a very good idea to get the communications team and the communications subcommittee working on messaging for the set of issues that are surely coming. And maybe we can get ahead of it, which would be terrific. And since the communications subcommittee has sometimes been searching a little bit for a mission, this could be a very good thing to work with as recommendations are starting to be rolled out. Perhaps we can be ahead of them. Keith, is there anything from your experience in Washington that might inform how we go about this without getting in trouble with powerful interest groups around the state?
I don't know. I'm not sure what kind of trouble you're talking about, Larry, but I think that the comment that you made earlier about the state of the budget is going to make what CIRM is doing more visible than ever and a bigger target than ever. So I think that getting this right now, getting our process correct now, we're really focused on process, is going to be an essential element of not getting in trouble. But I'm not seeing anything right now at the national level that is something that we have to pay particular note to, except for what the point that you made about the budget.
Great, thanks. Sorry to put you on the spot, but I just couldn't resist. Other comments or questions from the group? If not, Scott, remind me that it's time to open it up for public comment then.
That's right, Larry. I believe Richard Horgan had a comment. Richard, are you on the line?
Yeah, can you all hear me okay?
Yeah, just a reminder that we have 3 minutes for public comment, so please proceed.
3 or less, you got it. So thank you for taking the time to listen to me. My name is Richard Horgan, and I'm the founder and CEO of a nonprofit biotech called Cure Rare Disease. We work to develop ultra-rare therapeutics for neglected and overlooked populations across the United States primarily, but also Canada and Western Europe. We do this through a collaboration of academics, some of whom are in the very state that CIRM is located in. So a couple points to make. So I come at this representing the ultra-rare disease community. One of the comments made, I think, by the gentleman Shlomo's point about messaging, I strongly agree that this will look very poor from an optics perspective from the ultra-rare disease community, many of whom have already reached out, very frustrated that one of the only mechanisms available to advance promising science into the clinic has now been paused. For context, ultra-rare disease patients, although there's no official definition, is informally non-commercial diseases that are impacting populations that are historically neglected and overlooked. And so what I really, really, really encourage you all to consider as part of this process, and I understand you're in the process development part of this, is equity in who receives it. Many of the diseases that we work with, those that are non-commercial, those that we call ultra-rare, have no other opportunity to receive any sort of funding to advance programs beyond that pre-IND stage. Families, many of whom I've encouraged to join the next call later this week, have worked very hard and very tirelessly to raise money to work with academic scientists to develop a therapeutic to a certain stage. However, once you get to that pre-IND stage, scaling up manufacturing and GLP toxicology becomes a very, very expensive effort to which very few families can support. And so I really strongly consider and encourage this group to consider the ultra-rare disease community that has no other available route to financing the development. Other diseases that participate in this program, such that are commercializable, do have other options to raise funding, venture funding, and other grant funding that historically these vehicles have suited these populations better. But again, the ultra-rare disease community does not have access to these options. Existing applications for clinical development programs 1 and 2, I would note, have been vetted by the FDA. And with these programs that we work with, especially, funding is the major roadblock here to treating these patients. And so I cannot emphasize enough the dire strait that this patient population is in, being overlooked, being neglected, and having no access to capital to engage in capital-intensive exercises, such as GMP manufacturing, such as GLP toxicology studies, to get a drug into the clinic. And so please consider this group as a very vulnerable, very sensitive group that will pay a very, very, very steep price for not having access to funding that this incredible program that you all champion allows them to have. The wrong decision here, don't get me wrong, will cost lives. These are families that are desperate to be able to advance therapeutics and work with great academics, some of whom are on this call, to try to take a shot at helping their loved ones not die from these diseases. And so in closing, please consider the ultra rare disease population. Please consider the equity of the process that you're developing in relation to these neglected and overlooked diseases. Please consider that programs having applications submitted for ClinDev 1 and 2 have been vetted by the FDA via a pre-IND meeting. And please don't leave these patients behind, because almost every other opportunity has left these patients behind, from venture capital to the vast majority of NIH programs. CIRM is one of the only beacons of hope that these ultra rare disease patients have, and please don't let them down. Thank you very much for the opportunity to make a comment, and if there's anything else I could do, please don't.
Thank you, Dr. Horgan.
I don't see any other hands raised, and no, I think that will cover the public comment for the meeting. Larry?
Great. I think we don't have any additional agenda items, but what Rosa and the others have. Whoops, Corin Temple Perry, please.
Hi, all. I just wanted to drop in and just mention regarding messaging that the communications team will start working on this. I'll work with the communications subcommittee to start working through messaging and any sort of other needs to communicate that. So we did hear that loud and clear. I just wanted to pop on and just let you know that that's something that we will prioritize.
Great. Thank you very much, Corin. Appreciate it. Anything else anybody wants to add? I don't see any hands. Thank you, Maria, for
Looks like
up.
Maria. Oh, she put it down.
That's a thumbs up, not a hand. She's expressing approval in a silent way. Okay, with that, I suggest that we adjourn. There's a lot of work to be done. Thank you all.
Thank you, Larry.